I'm ready to talk about erectile dysfunction in a way I've never been ready before.
Okay, that's how the episode's going to start. So let's get into that email. Middle tier patron.
Wait. We get in trouble if we don't introduce who I am because people don't always know me.
Well, who are you?
So my name is Rebecca Bloom. I'm a licensed mental health counselor in Seattle, Washington. I've been doing trauma treatment for the last 25 years, and I'm in the process of attempting to get ASECT certified as a sex therapist. And I'm at the baby stage. I just went through a program. I'm doing 90 hours of independent study, and I'm heading into supervision next week.
The short version of that is Rebecca is the erectile dysfunction lady.
For now.
Middle tier patron and YouTube member Daniel from San Francisco. He says, hi, Dr. Honda and the rest of the Psychology in Seattle family. I love all the work that you do and consider you all to be some of my favorite human beings on the planet. I am a gay man in my 30s who is experiencing erectile dysfunction. My doctor has said it is psychological because my blood work has shown that nothing is wrong. This makes sense considering my sexual history. I come from an abusive, religious, sex-negative household. I faced homophobia and endured sexually abusive situations. I avoided the issue throughout my life because I avoided intimacy in general due to my low self-esteem. I eventually found a therapist a few years ago, and after having healed from some of my past trauma, I realized that not only do I deserve a mutually satisfying romantic relationship, but I also want one as well. I spoke to my therapist at the time about my erectile dysfunction, but he said that he was not knowledgeable on the subject as that was not his specialization. We had to end our relationship due to him leaving his practice. While he helped me in so many ways, my erectile dysfunction has still persisted. I am thinking of seeing a sex therapist, but I am not even sure how to begin looking for one. How does sex therapy differ from that of other therapeutic practices? Would a general therapist be able to help me with my situation? I want a romantic relationship, but I'm afraid my erectile dysfunction is holding me back from having a romantic relationship. So, as the resident expert on penises.
You're so much more knowledgeable. But this is good learning for me. Everyone will learn with me. So I did my research. So thank God for once you sent me the questions ahead of time.
Yeah. I've been organized. Well, lately I've finally crested a hill regarding work-life balance such that I can tend to these more luxury kinds of time expenditures, such as actually sending you the questions beforehand, or even just me looking at the questions beforehand. So go ahead, please.
So the deserving listener brought up something really interesting. Daniel, thank you for writing in. This is a really brave and interesting question. So 30% of erectile dysfunction is related to blood flow, heart issues. So so any mental health issue that we're addressing, we need to rule out physical health first. So that's been ruled out. And it's interesting. I did a little research of like, how do you increase your blood flow? And one of the answers was just walk 30 minutes a day. That a lot of this is like physical activity. And along with issues like vaginismus and vaginal dryness, there are pelvic exercises that you can do to increase blood flow to your pelvis. So just a side note, if it was a physical issue, there would be lots of answers to that. There's medications, there's adaptive aids that can be used. But this person seems really aware that it is psychological. So there can be a lot of focus on the thing, right? Like for people like, I want an erect penis, I want to have an orgasm. And people get so stressed out kind of trying to get to that goal that they miss all the little steps in between. So what is the difference between sex therapy and a generally trained therapist? I got 0 sex therapy training in my...
Did you have any sexuality training?
I think I had some gender and sexuality training.
Because in marriage and family therapy, it's required.
Okay.
Because of marriage. But not much. So, yeah. I mean, not only are you going to find a lot of therapists with minimal to none regarding education or supervision on sexuality or in general, but erectile dysfunction is a sliver of that overall pie, So, yeah, in terms of answering the question of Daniel's of should I seek a sex therapist or a general therapist, if you seek a sex therapist, you can go online to the ASECT website, I believe, right?
Which is AAS.
American Association of Sexual Educators and Therapists. I'm just going to take a guess.
Counselors, yeah.
Sexual educators, counselors, and therapists?
Yeah.
AASECT.
Yeah.
Just type in certified sex therapists. You could also, I'm guessing, go on Psychology Today, which is the default yellow pages for therapists, and just do a search for sexuality or even erectile dysfunction, I'm guessing. And if you find a sex therapist, in all likelihood, they are more likely to be able to help you with erectile dysfunction.
I mean, first off, they'll be comfortable talking about it, which is one of the main things that I've noticed in my training, is there's so much desensitizing experiences where we just have to talk about it, think about it, write about it, watch it, like in a way that it just becomes more normal than if you're with a therapist who's never talked with anyone about this before.
Right. Now, a general therapist like myself, I'm not a sex therapist. I've never taken a class on sex therapy, but I have helped a number of people with sexuality in general. There are topics that I don't know much about that I will refer out for, but if I know enough and am confident that I can learn in between sessions enough, if it's worth it, sometimes because it's not, I can't think of a time when someone came to me only with a sexual issue. They came to me for something else, and then this just came up, So I would debate in my mind about the benefits of me taking it on versus having them have it to look for a whole other therapist and terminating or adding another bill to their life. And so I would, over the 25 plus years, have acquired knowledge because of that. Like with erectile dysfunction, I had some very notable clients 15, 20 years ago that accelerated my learning and gave me a foundation of understanding. So the thing that I'll say is, in addition to what Rebecca said, which is great, is that it sounds like what you did is you went to your general physician and they did some blood work. You said, your blood work that showed nothing was wrong.
And they should be looking for cardiac issues of blood flow.
Yeah, blood pressure. But there's so many roads to a non-psychological, and we have to, it's weird to even separate mind from body, but if we just use that nomenclature, then for the physical side of things, there's a lot of possible factors and causes that are, one, hard to detect, and two, even if you detect them, you don't know if that's actually what's the cause is. Like you could have, for example, some sort of heart condition and conclude, oh, well, you're erectile dysfunction. I'm just going to call it boner problems. Because that's another thing that I do in my practice. Erectile dysfunction is kind of hard to say, and it also just makes it sound so, to me as a
clinical,
dude,
yeah.
it just makes it sound so severe.
Yeah.
Everyone with a penis has boner problems occasionally. It's not a big deal as a thing. Like, let's just take out.
Your boner can't work all the time.
Right. It's rarely working all the time. So if it was, my goodness. So with boner problems, you can go to your doctor and they could be quite confident that it's psychological. But in my experience working with a lot of clients, you just trying to find a doctor, a physician that really, even a urologist that really takes this on in a serious way is, excuse the pun, it's hard to find that. And I think it's because it's not a huge priority, excuse the pun.
Which is interesting because if you see the amount of Viagra ads on TV, you would think it was the number one priority in our culture.
Well, because it's an easy fix. It's a pill, and there's tons of money in that. There's not a ton of money in a physician scrutinizing and running tests, and also like the science just isn't there. It's hard to lock down exactly what's happening. In my experience, most of the time with clients, it becomes, especially if it's chronic and persistent, even if it is partially it's hard not to make it psychological eventually, right? Even if it starts physical.
Yeah, you get into the expectation that you will fail, and then you fail.
Right.
And like, what is failure in sex? I mean, I was going to say, to address this, you'd have to slowly, with this client, address what is pleasurable and spend time there, and not even work to the point of boner, but work to the point of pleasure. And then when it feels like you're hitting a point where your self-doubts come in, slow things down and understand that point of self-doubt.
Yeah. And what I do with clients, and this is what I've found to be true about any sexual issue in therapy, which is that this issue is the tip of the iceberg, as Daniel has pointed out. The boner problems are one thing, but the rest of it is the sex negativity and the sexual abuse and the homophobia. So, the boner problems is just a symptom, or the most obvious symptom of a much larger issue that working on this will blossom into working on all those other things.
To know that you're allowed to have a boner, it's okay.
Yeah.
Your boner is your right.
Yeah. Imagine what internalized homophobia could do to your perception of your own boner. You know what I mean? Just like, this is a representation of just how sinful I am or something. You know what I mean?
Yeah. So last night, the assignment was to watch this hour-long video on the history of sex and spirituality in the Eastern world versus the Western world. And it was really interesting at how much in the Eastern world sexuality and pleasure is a part of the sacred texts of those cultures. And in the Western world, it is not.
Yeah.
And so if you are told...
Or explicitly... Right, in the sacred text, it's stated you should not participate in pleasures of the flesh.
So this idea that, sex is only for procreation, sex is, and any other type of sex is a sin. This is the basis of the Western world's view of sex, and why. So I don't know if I talked about this last time, but I was reading this article about how Freud was actually fine with homosexuality. And it was all of his kind of second-tier followers who were like, no, sex is only for procreation. Homosexuality must be bad.
It's complicated. Freud lived a long time and talked and wrote a lot. And he only touched on homosexuality a handful of times. And at first he was not okay with it, meaning that he had the common notion that it was a perversion of normal sexuality. Then he, after I think having clients who were gay, changed that, but he did still hold at least the little bit that he did talk about it as it being an immature version of sexuality. Yeah. Meaning that, when you're a boy, you're going to experiment, and some people are stuck in that phase. But at the same time,
I've been stuck a long time.
Huh?
I've been stuck a long time.
Yeah. Well, stay youthful. And he also would push back against over pathologizing of it. So, for the time, he was massively progressive. But for us today, he's not something that we want to look to as a model for understanding, the rich lives of these folks and how difficult it would be.
Have you ever watched Torch Song Trilogy? Oh my God, he was in. He plays the makeup artist of Mrs. Doubtfire.
Oh yeah,
famous in his own right. Anyways, he writes this play.
He's got a really deep voice. Yeah. I can't even do it. But he's got a very amazing voice. Yeah.
I'm like, you look it up while I'll tell the story. So, anyways, the premise of Torch Song Trilogy. And I think it's from the 60s. Harvey Fierstein. Is that right?
Harvey Fierstein.
So the premise is it is okay to be gay. And
he's still with us. He's 70.
He's quilting up a storm. He did Hairspray. Like, he's just brilliant. He's a brilliant guy. He's given so much to our general culture, and then to gay culture specifically, he is a really important icon.
You didn't go to Pratt, did you?
I did go to Pratt.
Okay, because he went to Pratt.
Of course he went to Pratt.
Because I was like, I think Rebecca went to Pratt.
I can see the Pratt education in him. He does it all.
BFA.
Yeah. So to find gay icons who say back to us, we are okay, is so important. And I would encourage this client to kind of find those people, like build up your arsenal of people that reflect back the life that you want to live. Because that's such a huge part of then discovering what your desires are. If you only seen models of life that you don't live, it can be really hard to know what you want, what you don't want, what you're attracted to, what is yours versus kind of what is pathologized desire for gay men, especially. It can be so, you can be given such a narrow window. Like when I was in the late 90s, it was just such this gym culture of like only one type of body was acceptable in gay male culture, and there was such a railing back against that. And it's been so interesting in the last especially 10 years to see gay men of all kinds of bodies being like, I have a great body, my body's perfectly good.
Yeah, right. So it's possible that Daniel is worried, because his problem, his worry is that as he seeks a romantic relationship, sounds like seriously for the first time in his life, that he has a lot of worries, including boner problems being one of them. And it's possible that it's both, that on one hand, he is not considering the variety of folks that he's going to be dating in terms of their attitudes, but at the same time, it might also be true that within the 30s, 30-something gay guys in San Francisco culture, there might be some stigma around boner problems, or the opposite might be true, that your quote-unquote stamina or virility, quote-unquote, is something that is talked about and rumored, and there could be some bullying going on. I mean, who knows? There's
right.
A variety of people.
I mean, my hope would be that Daniel could kind of enter into dating culture into a community where you could say, hey, I'm starting out. I've worked really hard on my sexual assault and sexual abuse issues, my intense religious upbringing that shamed me about my sexuality. And I'm kind of a beginner, and I kind of have some boner problems.
Yeah.
And any partner that he chooses, I hope, would understand those problems, and they could explore with fingers and toys and all kinds of things.
Yeah.
And eventually get to a place where his boner feels better.
Yeah. The prescription that I have, not only for this sort of boner problem, but just for a variety of things.
This has been the best discussion of boner problems I've ever had.
Is that I will actually prescribe that they expect the problem to happen. Another example, I'll have a couple that they've been married for 25 years and they haven't had sex in 10, and they've tried to engage physically, and it's very awkward because maybe they've had their own bad experiences, but at the very least, they just aren't really familiar with each other, but they feel very strange that they don't feel familiar because they've been together for 25 years and they have 2 kids. So why do they feel so strange? Maybe there's something wrong with them, but I try to reframe it as you're essentially dating again for the first time, but it's even kind of worse because
you know each other.
Because when you first met, it was awkward, but at least you dated people soon before that. Do you know what I mean? You've had a sex desert for the first time post-puberty in your life, so you're almost like 13-year-olds again, and just embrace that. The other thing is that I will prescribe it going not well. I'll say like, whatever you decide to do, whether it's take a shower together or get naked in bed together, or if boner problems are involved, just say, look, we're gonna we're going to roll around naked together and be sensual or laugh or just get comfortable doing that. And let's just figure that both of us are going to be physically uptight in one way or the other, whether it's boners or wetness or, being ready or whatever. And just expect that to happen so that you don't worry about it happening. And then if it doesn't happen, it doesn't happen. But the worry of like, but what if we just answer that question, it's not a big deal. Like, what if it does happen, as long as everyone, because a big thing with boner problems is that often the other partner is, maybe slightly disappointed, but hopefully they love you for much more reasons than that. Usually the partner is more worried about the boner problem person being disappointed and stigmatized. So if everyone, particularly if the boner problem person can step forward and say, I'm okay with having boner problems, it happens. I don't like it, but what are you going to do? And the road to wellness is to accept that it might happen and not to get all bent out of shape. Often the partners are, okay, as long as you're okay, then I'm okay, because I just like to roll around with you. Plus, I'm not having boner problems, so, you know what I mean? And so, and often the boner problem person can say, well, yeah, I'd rather not have boner problems, but I like pleasuring you, I like getting together with you. The road to wellness for my boner problems to go away has to do with me feeling comfortable, so the more we do this, the more likely this is going to work out.
Right. I mean, some of this is exposure therapy.
Yeah, exactly.
So I have a client who is dealing with a phobia, and they've had a good couple of weeks, and then they had one bad day. And they came in, and we talked a lot about that one bad day and how there's going to be one bad day. On and off. It's going to flare no matter how much work you do. There's the potential that it still shows back up, and that's totally natural. This kind of Western patriarchal view of like only success. We only have good days. Just is tremendously damaging to people.
Yeah. And toxic masculinity is such that it says that you're basically a walking boner and you always want to do it, and you don't ever have any sort of anxiety or any kind of physical problem. You can last all night long and go 5 times a night, and you're up for it. You're never not in the mood. These are ridiculous, cartoonish versions of humans that might exist for a percentage of dudes when they're 13, but not beyond that. But there's plenty. I had a teenager that had had boner problems that talked with me about it. And so
often the shame is worse than the actual thing.
Yeah,
Great.
Right. So just, Daniel sounds less ashamed than other people because he's talking about it openly. But I'm guessing, there is some shame there. The other thing, Daniel, is that if you were to start dating and swiping right, I don't know what Grindr, is a right left thing? I don't know.
I've never been on Grindr.
What's the lesbian one? Her? She?
Her. Yeah. There's always a new one.
Yeah, what is that? What is, like, there's always a new one. Like, it was Tinder for a while, then it was Hinge.
Yes.
It's like...
then there's Field, if you're poly. There's always the OkCupid is still around.
Okay. Is it because, like there, in Seattle, there was always, like, a club would become...
Right.
super cool, but then it would fall out of fashion. There'd always be a new club that would... Is it kind of like that?
Well, and I'm wondering in internet dating language if one of the ways to talk about yourself is to say that you're demisexual, to say that I need an emotional connection with someone to proceed sexually.
Right.
Because you're going to need
sad.
that.
It's sad that you'd have to identify as this other thing, which I've actually found that some people will do, that they'll say that they're demisexual, meaning that they need an emotional connection before they feel sexual attraction or arousal. And I'll hear people say that, and I'll say, well, that's most people. It's a false notion that that culture is telling us is the norm, particularly for men. So let's not say you're this other thing. Let's just say that the dominant discourse around what a man or what people should be is based on a lie, that sex is just this animalistic, and for some people it is. They can have casual sex all night long at an orgy that they don't even know anyone's name. That there's plenty of people that are totally fine with that or into that, but generally speaking, most people need an emotional connection of some sort of a feeling of safety, a feeling of mutual respect and care. You know what I mean? So anyway,
this sounds like you could probably make $1 million if you created an app called like Tender Heart or something.
Tender boners, boners with tenderness.
Yes, try a little tenderness.
I don't know. I'm trying to insert my boner everywhere, but so to answer your question, Daniel, your main question about where should you go, I'm going to tell you that I've worked with a lot of clients who have a hard time with this, and also it took them a while to find me, in that there's a lot of people out. So there's various different levels. You'll have people that know nothing about it, and I'm kind of glad that your previous therapist just said, that this isn't really my area. I find that to be kind of a problem on some level. It's just like, well, how about you make it a little bit of your area? Because if we all as therapists just say, well, that's not my area, then no one has anywhere to go. But anyway, there's different tiers. You'll have the lowest tier of people that just know nothing about it, and it's pretty clear. You have the upper tier of people that know a fair amount, but there's no way to know everything about it. And there's no expert out there that will be able to quickly just identify exactly what's wrong with you, quote unquote, and fix it. Because I've never seen that happen. I've never seen it happen where someone takes like a supplement or they do a Kegel or...
Oh, right. Kegels are another one of the things. Well, and also I always say to people, like, how long did it take us to get into this problem? It's going to take us a while to get back out.
And then there's a middle tier of people that know something about it, that they might use that knowledge in a good way or they might use it in a bad way, like going to a physician that I'm guessing you went to, Daniel, and the physician ran a blood test and said, okay, it's not physical, not my problem, go talk to a psychologist. That sounds like someone who knew a little bit about erectile dysfunction, enough to run this test, but not enough to give you the full rundown, or at least didn't spend the time to tell you that there's a chance that medicine is not able to answer the question definitively about whether or not you have a physical factor that's playing a role here or not. In fact, it's rare that physicians will ever say that because they either don't know it or they're just insecure about their profession in general. Which I've seen many, many times with this issue, because they're not going to get called out on it is the thing. Like if you don't know your shit about like heart attacks or something, then there's not a lot of stigma around that. People are going to like say, hey, you didn't know anything. The average patient that presents the issue of erectile dysfunction is going to shyly ask a question. The physician will quickly provide this simplistic answer, and then the patient will just slink into the background. And so, the medical profession isn't being called out on their bullshit around this in general. So, Daniel, you might have to cobble together your own treatment plan, if you will, depending on how things go. And this is multifaceted, of course, because there's also like the endeavor, or I don't know what to call it, the embarking into romantic relationships is a whole other thing, But yeah, so that, I wish I could tell you, Daniel, a better answer to that. A sex therapist is more likely to have good answers.
Yeah. And really be able to just talk it out with you and say, I don't know, but I'm going to take a look around and see what I can find.
Right.
And I'm going to come up with, a lot of sex therapy is homework. Like, let's try you walking 30 minutes a day and every other day doing these pelvic exercises, like just to be in your body in a healthy way.
Right.
And slowly build on more and more homework exercises to get you back in your body in a safe way.
Right.
Because, chances are there's lots of ways you don't feel good in your body.
Right. There's so many things I could talk about. Alcohol.
Right.
Are you having a boner during masturbation? Are you getting morning wood? There's all these questions to kind of differentiate if there's a blood flow problem. The other thing is there's nothing wrong with Viagra. There's no stigma around it. So, I mean, there should be stigma around it. It's thought of as like a grandpa kind of thing. But, for some people, it could just be like what gets you over the hump, so to speak, of like,
knowing that you can do it.
Yeah, and then once you feel comfortable with your partner, you stop using it, and then maybe there's a little bit of a boner problem, but then your body gets comfortable with that situation, exposure therapy, and then, you're off and running. Of course, talk with your physician about that, but, there's no shame in that game. All right, let's take a break. We get back.
So many good boner thoughts.
All right, back from the break. So I want to do an OPP. So these people I finished with shouting out all of the people who were patrons at the time who had, become a patron years and years ago, because I want to highlight those people. Because in order for us to feel like we have stability in our lives, we have to have people stay patrons over time, And I, after finishing 2021, I went back to the very beginning and looked at people who have been patrons the longest. And so I got through the 10 or 12 people who are still patrons after signing up in 2015, 9 years ago.
Wow. And
then the 20 or so people who are from 2016, but then these people are also from 2016 and they're upper tier patrons.
Will you say their location?
We have Beth from Olympia.
I'm going to lead a workshop in Olympia on Friday.
Oh, on what?
On tarot and therapy.
Beth, I have met. I walked her to her car, actually, after one of our live events. And I don't know if Beth is a therapist, but maybe Beth could even go to your thing. We have Noah from Los Angeles.
LA, baby.
We have Alex from Salem, Oregon.
Which is the capital. We
have Claudia from Solingen, Germany.
Wow.
And Rachel from Auburn, good old Rachel Wright.
I love Auburn, just south of Kent.
Another person that I've met in person, Rachel. Nick from New York City.
It's a Big Apple.
So those people have been not only patrons, but upper tier patrons, middle tier, upper tier patrons since 2016, y'all.
That's amazing. Thank you.
Next question, anonymous listener. She says, my therapist told me that she is in love with me. I was diagnosed with complex post-traumatic stress disorder and depression. That's why I have been her client for 3 years. I'm not okay with her saying that she is in love with me. What would you do in this situation, Rebecca?
I would run away.
Would you?
I mean, why? Why does she have to tell her that she's in love with her? Like, why, especially someone who is fragile and addressing attachment issues, why do you have to put your crap all over them?
Yeah.
Why can't you just do your job as a therapist?
Well, you've heard of the principle that when this happens, you're supposed to just disclose it. Otherwise, it's crazy making. You've heard that, right?
No.
I have.
Okay.
I think it's like a humanistic 60s, 70s thing, like a Fritz Perls thing, or I don't know, maybe even a psychoanalytic thing. I don't know. There's some old school aspects to it.
It's really old.
Yeah. I mean, so there's a number of problems here. One is that erotic or romantic countertransference is rarely, if ever, talked about. And if it is talked about, half the time it's bad guidance. So we've been talking about this in our field since Freud. Jung would write Freud in letters. I have this, one of the giant books behind me is all the correspondence between the two of them. And Jung would talk about how he was having these countertransferential feelings, erotic and romantic. It's fictionalized in the movie with Viggo Mortensen and Fassbender and Keira Knightley. I think it's Cronenberg movie. I can't remember the name of it, though. In that movie, they take some leaps in terms of assumptions about Jung and Spielrein having not only a sexual relationship, but like a BDSM relationship. But anyway, we've known about this a long time. There's a lot of research on it. It should be talked about more so that people have more complex and more sound understandings of what approach one should take.
Well, and what is the therapist doing by saying, I am in love with you? Right? That is their complete fantasy. I mean, their experience of this person is 1 hour a week where this person is being very emotionally kind of raw and present. That isn't the whole person.
Right.
So they're in love with a fantasy of this person.
Yeah.
Have you watched the documentary yet about the woman that does assisted communication with someone with severe cerebral palsy and then...
No, but I've seen and looked at a lot of the research regarding that sort of work. Yeah.
So she begins a sexual relationship with this person. She has sex with him twice, and
I think I'm aware of this particular case. Yeah.
And the question is, and then other research come in and say that this person is not using assisted communication. This person is basically functioning at the age of an infant.
Yeah.
Anyways, but there's a really interesting moment in the documentary where the expert on communication says this woman's basically having a conversation with herself.
Yeah. And doesn't know it.
Yeah. And is supposedly a trained expert in disabled communication.
Yeah.
So, as a therapist, this is me speaking my truth. As a therapist, if I say I'm in love with one of my clients, I am projecting all over them because I don't really know them. Mm-hmm. They don't really tell me everything. Mm-hmm. And they don't really know me. I'm the person that provides a beautiful, quiet environment and gives them tea. And, it's just lovely in there. And I have, my sweet dog. And my sweet dog never pees on the carpet when they're there, unlike in my home. It's just kind of this ideal little fantasy space. Mm-hmm. We're not building a romantic relationship here.
Yeah. Right. And it's almost universal that when therapists and clients engage in relationships outside of the office, that relationship will not only go poorly, but it will traumatize the client, sometimes even the therapist. And that realization you'll hear that where the client will say, after a year of being in a romantic sexual relationship with their therapist, they'll say, they're different now. They no longer listen to me as well as they used to. And you're like, well, yeah, they're no longer your therapist, So now I don't blame clients. I blame fucking therapists.
Oh, yeah. I mean, who has the power in this dynamic?
Yeah. Who should have the training. But yeah, so, we don't know what the therapist is thinking. I could imagine various different stories. Each would be a problem, but some would be less of a problem than others. This could run the gamut anywhere from the therapist is wanting to engage in a romantic sexual relationship with her client. That's at one end of the spectrum. But at the other end, which is still a problem, but it's less of a problem, is that the therapist is going to uphold the frame and the boundaries and will not engage in the slippery slope towards a relationship with the client, but has been dealing with these feelings and is ill-trained and ill-supervised such that she believes that it would be harmful to the client to withhold that information because the client will pick up on it and it will be confusing to the client. So that's still a problem, but that's less of a problem.
Yeah, I mean, there's so many other ways to say that. Like, I'm trying to think of ways that I say to my client, you're doing great. I'm so proud of what we've done. I'm proud of what you've done, really. Like, I have a bunch of clients right now that have met these huge goals that they set for themselves years ago. I have 3 in a row. This never happens. So it's wild to watch. They like all clicked off in a row. And
that's a good feeling.
It's let me shout from the rafters. Like, and I told two of them, you know, you've reached this huge success. Another client of mine has reached this huge success. Like, I just need to tell you as a therapist, this doesn't happen very often.
Yeah.
I mean, that is my way of saying, like, I love this work, and I'm amazed and surprised.
Yeah.
At what can happen in this room. But
I mean, have you ever been in love with a client?
No, but I'm not a very loving. I mean, I don't fall in love real easy.
Well, so I think this is another issue of you're not suddenly in love with a client.
No, it builds.
Right. So there's a chance that this therapist wasn't doing anything as soon as it became...
Who should they have talked to besides their client?
Right, exactly. They should be talking to their own therapist and or a supervisor or a colleague, and this should have been nipped in the bud, I'm guessing, a long time ago. Now, anonymous listener, you say that you value this relationship. You've been seeing this therapist for 3 years, and I'm guessing that's because your complex PTSD and depression has been helped by this therapist. So you're saying, what do I do? You know, the easy answer that the internet will say, well, you got to terminate because there's a problem. That's much easier said than done. And if I were in, this is just me, if I were in your shoes, if the therapy is helpful, which is kind of hard to find sometimes, I would ask my therapist, or I would play them this clip and say, what do you think about what these other people are saying? But I would try to get my hands on the wheel and say, I like this relationship. I want you to be my therapist. I don't want this to be a topic. Whatever's going on with you.
Take the wheel.
Whatever's going on with you in
really
your feelings.
That's really sad that the client has to take that level of...
It is, but the only other solution is what? The client just
terminates
or hopes that it's going to work out. You know what I mean? Because it sucks that a client would have to do that, of course. But given the scenario, if I were the client, I wouldn't trust the therapist anymore unless I got my hands on the wheel and got the and it really would depend on what the therapist would say. Like if I did all that and elaborated and the therapist was like, oh my God, you're right. What's going on in my personal life, I won't bother you with, but this has everything to do with what's going, because it usually does, divorce or alcoholism or something. I'm sorry to have burdened you with this.
I have the boundaries.
And so let's reestablish that. Mm-hmm. If I don't ever bring this up again, just know that I'm dealing with it and I'll be fine. So let's just go back to the way that things were and just categorize it as I had a weird month and I'm sorry about that. If my therapist had something along, it's kind of specific, but if my therapist had some response kind of like that, then I would, test the waters for another few months. And if things seem to be going well, then I would continue doing that. That's asking a lot because if the therapist is saying that, as I say, well, usually I would say stupid as stupid does, but I changed it to another phrase of, what was it? Oh, because I hate, I'm not good with idioms, but I liked the tip of the unethical iceberg. That's what I eventually got to.
Yeah. I mean, I was wondering what theoretical framework is the therapist coming from to say, I love you?
Yeah.
Is it some super outdated practice from 1960s that no one else does anymore? Mm-hmm. Have they completely lost their therapeutic framework and are just in kind of an id state of, are they expecting the client to say, I love you back? And there was recently, this couple came up in the news for a completely different reason, but I saw the face of the woman of a very, very famous situation from the 90s where a Seattle therapist married a client. So I know these dynamics happen.
What was the outcome of that?
I don't know if they're still married. But The therapist was in a group practice, and the group practice fell apart very publicly. Another member of the group practice, this was back when there was like 8 out therapists, and another member of the group practice, I don't know if they put a letter in the Seattle Gay News or what, but like everybody heard that they had just publicly said, look, I don't support what my peer has done. I am stepping out of the group practice because of this. It was a big deal.
And did the therapist who started a relationship with the client publicly say anything? Defend themselves?
Not in my memory, but I think I was so shocked at the time.
Yeah.
Like, oh God, this can happen. Like, and at the time it was like, oh God, this can happen in my community. It was back when I still had fantasies that like all of the troubles of the straight world wouldn't show back up in the gay world.
Yeah, it's hard to know. The other possibility is that the client isn't fully understanding what the therapist said.
Right, like my hope, I'm like holding on to this hope, like, is the therapist saying like, I love you, like, you're great, I love you.
Yeah.
Fingers crossed.
Or the therapist was saying something like, maybe I'm just trying to come up with something. The client might have been going down a road of low self-esteem, saying that she didn't believe that she would ever be lovable or something. And then the therapist says something like, tries to help, and it's really a stubborn schema of the clients. And then the therapist says, you know what, there have been times when I have had romantic feelings towards you. I'm not acting on them or anything, but as I say this out loud, it's ridiculous to say something like this. But maybe it was something like that, where, because the analogy that is, I think, more common is you'll have a client that believes that they're disgusting, and you have a therapist that says, actually, you're attractive. Take it from me. I'm not actively attracted to you, but if I saw you in, again, not advised as something to say, but that's much more likely of something that I would hear. And so, it's possible something like that was being communicated by the therapist. I don't know.
I'm trying to think of so often with clients, I say, I think you're great. Let's address your low self-esteem. Here are the ways that I think you're great. Or, and so many clients are wrestling are wrestling with low self-esteem, that the way to address it is to say, let's you and I work together to build up your self-esteem. The way not to address it is to say, I am attracted to you. That's not the answer.
It depends. I've seen, certainly not me, but I've seen other therapists pull it off. Certain vibes that some therapists will have that come across as very grandparentish, and they might be able to pull off an intervention where they're just like, hey, if I were younger, oh boy, you'd be number one on my list. Anyway, moving on. And as a client, you don't get this sense that the therapist is fantasizing about you or creeping on you. It's just this kind way of communicating. Like, when I think back to my first job as a therapist, there was an older woman. She was probably in her 40s at the time, but she seemed a lot older. And she was let's just say that she was higher up on the org chart, and she would do stuff like this to me.
And tell you that you were great.
The vibes of sexual attraction from her to me.
Oh God!
But not in a way that gave me the feeling like she wanted to get together with me. Mm-hmm. You know what I mean? It was like, as a young man, I would get this a lot, actually. Not because of just me, but because I think back then it was much more common to treat younger people this way, women in particular, but also young men would just be identified as, like, I was the only young man on staff. And it was a lot of women, because there's a lot of women in mental health and a lot of women and a lot more women in marriage and family therapy. And so when I walk into the room, I represented some new thing. And the way that a lot of the older women viewed me was this like a nephew. And it's not uncommon for aunts to do this as well. Of just like, oh, you're probably, tearing a trench through the college ladies, or I don't know, whatever.
Oh my God.
You're probably spreading your seed, or I don't know, whatever they say.
Oh, this is awful.
But I would get that a lot, you know what I mean? And as a young therapist, I'm trying to get respect, I would play along with it. They would put hands on me,
Oh, wow.
They would massage me and come up behind me while I was at my desk doing my progress notes and but it always came across like an aunt to a nephew. It wasn't great, but it wasn't, I didn't feel unsafe, let's just put it that way. And I didn't feel like I had to parade myself around in a certain way. It's similar to when you and I were the young professors in Antioch, that I would get pigeonholed, and you would too, as the IT people. Whenever there was a computer problem, you trained me.
I know, it's crazy.
You are pretty good with computers, but but you're not like on average.
No,
you know what I mean?
What it is this is my dyslexia. I can learn something because of my dyslexia. I have to learn something in this really systematic way. And then it's one of those adaptive aid things. It's it turns out that's really helpful for everyone. And that's why I had that gig teaching people how to use the.
But don't you also think it was because you were young that it was forced on you? Yeah.
No, well, it wasn't forced on me. It was offered to me.
But why would it be offered to you if, you know what I mean?
Because I taught everyone. I don't know if you were at that staff meeting. I wrote out a step-by-step of hey, this is new and scary.
Sakai?
Yeah. Let me show you step by step how I learned it. And everybody, because what would happen in our job is anything new, I think this happens at most jobs, anything new comes up and everybody's like, oh God, I can't.
Because up until maybe, what year would have been, the late aughts, maybe 2006, 2007, Antioch University was largely a non-computer university. Everything was done on paper. I would submit my evaluations on paper, and they would go into a physical file. All the grades and the records of the students were all non-computer. It was all handwritten. And I remember the transition to computers, which just sounds so stupid. It's for the young people in the audience, it's what do you mean transition to computers?
Right.
And because we had the capability of having it be computerized, and certainly other universities like University of Washington, it was computerized as soon as computers were invented, right? When I registered for classes in 1989 in my bachelor's degree, it was computerized, So you were around when they transitioned to Sakai. I was an adjunct at the time, so I would have observed this from afar. But then you get pegged as. Anyway, my point is that as a young person,
there are certain roles that we get it,
and whether you want it to be, whether you want to be seen that way or not, and it's a little bit of a pigeonholing as well, because as a professor and as a therapist, I wanted to be respected as a therapist and as a professor. I didn't want to be, oh, you're the tech guy, or because I'm Asian, oh, you're you know about computers, you need to figure this thing out. I was happy to help, and I was happy to have the job, and I was happy to get at least some respect, but that wasn't where my soul resided. And I, not to be arrogant, but I was a fucking good professor back then. and eventually, because I'm Asian and young, I became the data management professor, and thus could see all of the evaluations of all the professors. And I was rated very, very highly. One of, if not the top professors in my certain category. And yet people would continually just see me, like there would be a computer. Oh, Kirk will handle that. When a professor problem came up, they didn't turn to me, even though I'm like, I at the very least, I want to be known as a good professor. I don't want to be known as the tech fucking guy because I'm Asian,
Yeah.
So in the similar way, when I was a young therapist, I was seen as like this, I don't know what you call it, like a young single male. I don't know what sort of role that can play in a room, but it was a role. Anyway, let's take a break.
Okay.
Okay. Next email, YouTube member from Palo Alto, anonymous.
Talking about tech centers.
He says, my wife has left me because I was abusive. I never hit her or thought about being physically abusive, but I have used coercion, intimidation, emotional abuse, and blaming. So my wife has left me because I was abusive by being coercive, intimidating, emotionally abusive, and blaming. So it sounds pretty awful. I love her and she loves me, and we're trying to work through things. I'm not sure how I can show her I'm doing the work and identifying my patterns. Is it possible for me to change? How do I change, and what steps do I take? End of email. So it sounds like he is asking these overt questions, but it also sounds like he's wondering how he could show her so that she doesn't leave him ultimately, right? Or not have the door open to possibly them re-engaging in the future. Rebecca, what do you think?
I mean, I would want to hear very specific behaviors that he acknowledges are wrong, and the coping strategies or new behaviors or replacement behaviors that he's going to do instead. Yeah. So, like, I was coercive. What exactly behavior are we talking about there? Is that withholding funds or other things? And then what's going to be the plan in the new relationship? And what are going to be the checkpoints along the way? So there used to be in town a practice that specialized. They were called like ABC or something, and it was for men who were domestic violence perpetrators.
Oh yeah, I have a vague memory of that.
But there are specialists. I would want to make sure that you're seeing someone that knows what they're doing to address, like what we were talking about is behavior change. And I always say if behavior change was easy, I'd be out of a job. So, if you are, quote, working on it, what does that mean? Are you in therapy? Are you in a group? Are you working on yourself spiritually, emotionally? Are you addressing family patterns? Do you acknowledge where this came from? Are you hanging out with different friends? I mean, I hear from a lot of folks like, I got encouraged to do this by my male friends. How are you changing? And what are you doing to address your maladaptive behaviors, your anger issues, however you want to frame it?
Yeah. So, anonymous YouTube member from Palo Alto, I don't know what's happening because I'm not working with you, and I only have this little bit of an email. But my top hypothesis, given what you've written, is a very common profile. And if this doesn't fit you, then disregard this. But I've worked with a lot of perpetrators who present with this presentation and with the desperation of trying to get their partner back. And I'll commend you for taking responsibility. A lot of perpetrators don't. I'll commend you for trying to work on this, and I commend you for you're trying to get her to understand that you're working on this, and you're also trying to work on it. There's no mention of an actual program that you're in, so that, as Rebecca said, you want to work with a specialist. And like for myself, I don't advertise myself as a specialist, but I am a specialist because I have worked with perpetrators in the past, court ordered, and have integrated that into my work with my clients. I've worked with a lot of couples where this happens. I've identified this, I've in the midst of couple therapy, 2 years in, I'll say, I've come to the realization that you are abusive to your partner. I'll say that right in front of the everybody, and then we have to deal with that word abusive, and it's not easy for perpetrators to identify that way. But I've helped people, because that's admitting that you have a problem is the first step in having the proper word for it, even though it's shameful. But so the profile that you have some hints of is someone that has a lot of attachment injury from your past, from your childhood, that manifested in your relationship. And you also had some modeling regarding intimidation, coercion, emotional abuse, and blaming. And you were using those techniques as a way to, what you thought, subconsciously anyway, was managing the closeness. You thought that in order to keep her close, you would have to engage in these kinds of behaviors to keep her close. So, you're trying to retain the closeness. I don't know this, but that's often what it is when I hear something like this. Then at some point, she can't take it anymore and she breaks up with you. And then now you're even more worried, right? You're even, you're hypervigilant in a new way. In the past, you had this pattern of avoiding your feelings. I don't know if this is true, but this is often what's true. And a lot of men are this way too. The preoccupation or the, semi-narcissism will be in this category. And then when the breakup happens, suddenly you're awake and you're like, oh my God, I've been neglecting her, and I need to change, and I do love her, and I do recognize and I agree with her, and all that is commendable, and all this is fine, and a result of the trauma that you went through, and also maybe toxic masculine ideas that you absorbed. And so your impulse and your urge to change and to get her to realize that you've changed, these are all good things, but you have to point it in the right direction. But it's fucking complicated, because there's nothing wrong with wanting to retain the relationship, and there's nothing wrong with her entering into this kind of liminal space where it's like, well, I've got one foot out the door because I don't want to be abused anymore, but I do love him, and I do see signs that he is on the right path, and so she's on her journey regarding that. And a lot of people from the outside would just say, leave him and da-da-da. But, there's a lot of paths forward that have health. So it's complicated and it's hard to navigate, but you need to have, like I said, where Rebecca said, you need to have someone that knows what they're doing regarding walking you through this. And it needs to be, pretty intensive. It's not only just your current behavior.
Right. Well, and also, so in psychology today, you'll often see people say that, they address men's issues, anger issues. And I don't know if you're in therapy right now, but I would want to have a deeper conversation with someone to say specifically, this is what's up. My wife and I are separated. I am realizing I have these abusive patterns. You got to do some serious work.
Yeah.
And did you learn, and if you learn these patterns in your family of origin, that stuff is really hard to let go of.
Which is almost always the case, by the way.
Mm-hmm.
So the path is long. You might be working on this for the next 20 years. No joke. Like seriously, intensely for 20 years, because it's emotional awareness. It's dealing with emotions in brand new ways, resisting old patterns. You're also acutely aware now of what likely has been going on your whole life, of your intense attachment insecurity, which is its own ball of wax, because that doesn't just go away. So, you have this aggravating factor of your partner, your wife, who has one foot out the door, and by definition, she is rejecting you. She is calling into question whether or not it's worth being with you. And that's going to be a constant thorn in your side, but it's a necessary part of this, because she deserves to have that out and have that space for her own safety. but you want to retain that relationship. So I've been through this with a lot of clients, and it's hard, but finding a specialist and maybe also having 2 or 3 different things. Like you have a specialist, a therapist, maybe also a men's group or some sort of online forum or something. I've also seen a lot of self-help books and podcasts that can assist, depending on what it is. But there's a lot of good stuff out there around like emotional health.
Yeah, you got to find a new way of being. Like,
Yeah.
Is it time to discover yoga or Buddhism or something
Right.
that regulates your nervous system so that you don't go into attack?
Yeah. And new relationships, having, your guy friends that maybe trim or cull the herd in terms of like, I want to spend more time with these friends who are more likely to talk about emotions and are more open to talking about that, whereas these other guys are maybe not so much that way. I've done a lot of work with clients. I have friends who go through this, and it's a wonderful chance and opportunity. It's wonderful to wake up like this, and I commend you, because you could have said, fuck her, it's all her fault, and started drinking or something, which is more common than what you're doing. But it's not going to be easy, and there's no easy answers to this, but you will benefit. And that's the other thing, is to prioritize and be on a foundation of how you are going to benefit, not how you are going to get her back. And that's, of course, you want her back, but you have to be prioritizing yourself, because if you're only doing it to get her back, then it's empty, and you will be disappointed because you won't actually change. And even if you do trick her to come back, she's going to leave eventually anyway, because you didn't really change. Plus, from her perspective, you don't want to engage in more coercion and intimidation of just like, look, I'm changing. You can route your coercive, abusive behavior into in your own mind of like, look, I'm just showing her how much I've changed. She needs to realize how much I changed. You're just being abusive again. So you have to let that go and really focus on you. And you deserve to recover from what I'm guessing to be quite extensive abuse, emotional abuse when you were growing up. Well, that does it for that episode of Psychology in Seattle.
Landing on a high note.
And everyone out there, please take care of yourself. Why should people take care of themselves,
because
Rebecca?
change is possible, and we love watching you change and hearing about how you want to change.
Yeah,
that's all. That's why we got into this business.
And if people want to check out Rebecca dancing with a fan to Small Town Boy by Brodsky Beat,
yeah,
you
Instagram
can go to
on our
text.
Yeah, I tagged you.